I'm Murray Aiken, Executive Director of the IQVIA Institute for Human Data Science, and I'm here today with my colleague, Jamie Pritchett, to introduce you to our new report, Understanding the Use of Medicines in the US 2025. We've subtitled this year's report, Evolving Standards of Care, Patient Access and Spending. And these are three important elements of our research that we feature in this year's report. How patients are being prescribed more drugs based on changing standards of care and increased disease prevalence and diagnosis rates, especially for chronic diseases. We also cover some of the challenges that patients face in being able to access the drugs that are prescribed to them by healthcare professionals. A lot of this is based on insurance design, including the patient out-of-pocket cost. And finally, the spending on medicines. As a nation, we're spending more each year. This year, a double-digit growth. So we drill into what's driving that growth historically and what we can expect over the next 5 years. Of course, there are many moving pieces these days affecting our healthcare system, new leadership in critical parts of the government, new executive orders and policies being designed and executed. So we know that there's a lot going on around us, particularly in 2025. We also think that's why it is important to have a baseline, a clear baseline of where things are, so that the impact of future changes can be properly assessed. And this is also a contribution that we hope that this report makes in the broader context of understanding the use of medicines in the US. I now want to turn over to my colleague, Jamie, to take you through some of the highlights of this year's research.
Thanks, Murray. The use of medicines in the U.S. has grown significantly as more patients receive treatment for chronic diseases and new novel treatments become available. In 2024, total prescription medicine use increased 1.7%, reaching 215 billion days of therapy. Growth in retail medicines was over 3% each year from 2019 to 2023, but slowed in 2024 to 1.3%. However, growth in non-retail medicines continued to accelerate to 3.3% in 2024, driven by medicine use in clinics and doctors' offices. Significant uptake of novel mechanisms has occurred across a number of therapy areas, including immunology, diabetes and obesity, HIV, and oncology, providing benefits to patients. Some of the most notable growth has been an uptake of GLP-1 agonists for obesity and diabetes treatment. Though patients predominantly using GLP-1 agonists for obesity don't align with the demographics of those living with obesity in the US. Not all areas are growing in utilization. Opioid use continues to decline, with per capita use returning to levels last seen in 1999 and a remarkable 29% decline in opioid-involved overdose deaths in 2024. Another area seeing declines are vaccinations, a concerning trend given the safety and effectiveness of these prevention measures. Flu cases have reached historic levels in the current flu season, while flu vaccinations declined 9% from last season and are the lowest since 2016 to 2017. Vaccinations for RSV and COVID-19 also declined 65% and 11% respectively in the current respiratory illness season. And adult and pediatric vaccinations, which had been increasing over the last few years from pandemic lows, declined in 2024. While medicine use overall is up, patients still face significant barriers to accessing medicines, including through limitations of their insurance coverage and the high costs of newer therapies. Of prescriptions written by providers for novel medicines, 56% go unfilled, and only 29% of patients remained on therapy for a year. This is largely due to payer rejections, which may be because the medicine is not covered, a patient does not fulfill prior authorization requirements, or for other predominantly administrative reasons. 17% of written prescriptions for new medicines are abandoned by patients, likely due to high out-of-pocket costs despite coverage by insurance. Across all new prescriptions in 2024, 96 million were abandoned by patients at pharmacies, with increasing frequency as costs rise. Payer controls don't just impact new medicines, but impact generic and biosimilar products as well. While generics are generally preferred, over 25% of new generic claims are rejected by payers 2 years after generic entry, which can limit generic uptake. In fact, the historic pattern of rapid and deep generic erosion and price reduction that we expect with new generics may not be continuing, as seen by the lower uptake of generics entering in the last 5 years compared to those entering 10 to 20 years ago. Additionally, biosimilars have seen varying degrees of uptake across molecules, and overall, biosimilars launched to date account for only 24% of competitive molecule volume. The degree to which a patient's insurance covers the medicine can impact the amount they pay out of pocket. Patient out-of-pocket costs in aggregate reached $98 billion in 2024, an increase of $6 billion, with most of the increase in non-retail drugs. Increases in retail out-of-pocket costs over the last 2 years have been driven primarily by the growing use of GLP-1 agonists for diabetes and obesity. Early impacts of the Inflation Reduction Act have provided some cost savings to some patients, and will likely continue to drive increased savings as other aspects are phased in. Fewer Medicare patients paid greater than $3,500 for prescriptions in 2024 as patient cost sharing in the catastrophic phase was eliminated. The annual out-of-pocket cap of $2,000 in Medicare Part D that went into effect in January 2025 could have saved 1.4 million patients on average $2,092 in 2024. Insulin out-of-pocket caps from both the Inflation Reduction Act and manufacturers saved patients nearly $681 million on insulins in 2024 compared to peak prices paid in 2020. Similar manufacturer-driven out-of-pocket caps in respiratory inhalers for the uninsured and commercially insured could save patients $672 million, though these caps will not benefit Medicare beneficiaries. These patient cost savings have not necessarily resulted in savings for all payers, as aggregate growth in spending on medicines has accelerated as more patients are prescribed novel medicines and standards of care begin to shift. The U.S. market at net prices grew to $487 billion in 2024, an increase of 11.4% and significantly higher than the 4.9% growth in 2023. This represents historic growth only exceeded in recent years by 2021, when spending was boosted by the first year of adoption of COVID-19 vaccines and therapeutics. U.S. net sales growth in 2024 was driven by a subset of 31 products, each with more than $500 million in growth from 2023 to 2024. These products include GLP-1 agonists, medicines with label expansions, and more mature products becoming established in clinical guidelines. Growth from other high-growth products and new brands was offset by losses of exclusivity of $19 billion. The largest amount of spending was on more than 3,000 products with moderate to low growth, which accounted for $208 billion of the $487 billion in net spending in 2024, and they declined in aggregate $1 billion. Spending growth was driven by immunology and oncology among specialty therapies, and obesity and diabetes in traditional therapies. Protected brand net prices were flat in 2024, growing just 0.1%, while list price growth also slowed to 2.3%, including the impacts of list price reductions for insulins and respiratory products. However, the median annual treatment cost of new medicines at list prices exceeded $350,000 for the cohort of 2024 launches, though these high-priced therapies often treat small patient populations. The U.S. spending forecast reflects continued growth driven by innovation, offset by notable expiry events, and the continued impacts of the Inflation Reduction Act. The next 5 years are expected to bring an increasing gap between list price spending, which will grow at 5 to 8%, and manufacturer net revenues, which will grow at 3 to 6%. List price spending is expected to reach $1.4 trillion in 2029, with net 57% below list price spending at just over $600 billion. Oncology and obesity will drive growth through 2029, while diabetes, immunology, and COVID-19 contribute to slowing growth. The U.S. healthcare system continues to be fragmented and opaque, and individual patients have differing experiences accessing care. We hope the detailed analyses in this report can help shed some light on recent trends in usage and spending and provide a foundation for discussion among stakeholders about addressing health disparities and ensuring that all residents in the U.S. receive the care they need.
Great. Thanks, Jamie, for that brief summary. Of course, there's a lot more in the report itself. It's 67 exhibits. It's 80-some pages. We do encourage you to download the full report so that you can read through at your leisure and really extract all the great insights from the research that the team here at the IQVIA Institute have done over the past several months in preparing this report. We also invite you to join our mailing list for the IQVIA Institute so that you can stay up to date on all of our research publications and events. With that, we thank you for your interest in this report and hope that you find it of great value and look forward to further opportunities to share our research with you. Thank you.